Okay, so the first thing I want to say before you watch this is that be sure to either one of two things, print off the PowerPoints and walk through them with me as I'm reading, or I mean talking through them, or make sure that you're taking notes because some of the things is going to be just like a class. I may say stuff and it may not be written in there. Again, this is going to be more of a direction so you can apply this information so you can know how to go to the book and study it. Because remember, I need you guys to be in this book and actually learning this stuff because everything builds upon the things we're going through. So we did a lot of this, so some of this I'm going to just be breezing through some of it. So the first thing we're doing is CNS stimulants. We're going to focus on a couple of the different categories of meds that you see and a couple of the different medically approved uses for those medications. So for ADHD, we talked about this, and come next term, I'll also be talking a lot about this again. But basically, it's thought to be some kind of dysregulation of transmitters in the brain, that dopamine and norepinephrine and serotonin aren't properly regulated. More common in boys than girls. Important to know. There's your characteristics listed right there for you with the ADHD. Also for narcolepsy, so remember we talked about this in class as well. Remember with the sleep cycle, there is a part of where a person experiences paralysis during the sleep. This is typically in the REM cycle, and it's so we basically don't act out in our sleep. That's why this happens to us. The patient with narcolepsy will go into this instant sleep paralysis. So very, very dangerous for both the patient and for others around them. So this is reoccurrent attacks of drowsiness and sleep during the daytime, and you can see the different areas of when they may fall asleep. So we use amphetamines. This is going to be your drug card. Remember, we have amphetamines and then we have amphetamine-like drugs, okay? So these stimulate the release of norepinephrine, epinephrine, and dopamine, hopefully to cause alertness, but it can cause euphoria as well. So we do sometimes have issues with abuse for these medications. Most of them are controlled substances. So look at your side effects and think about it. If I am stimulating the CNS, the central nervous system, what am I going to see? I'm going to see a high heart rate. The patient's going to feel that beating on their chest. I'm going to see an increase of blood pressure. But I can also, restlessness, tremors, so I can also see irritability in a person. Anorexia, meaning that they don't want to eat. Dry mouth, weight loss. So again, you sort of need to understand your CNS system and what's going on with it to be able to know what an amphetamine is going to do for the patient. So we also added to there that it can decrease white blood cells. So that this stuff, again, is for your drug card for amphetamines. Can be addictive. Avoid grapefruit juice, avoid caffeine, and do not just stop. This is something with our teaching that you're going to want to include in there. So with the amphetamine-like drugs or medications for ADHD, so they're not amphetamines, but they're going to actually work very similar, okay? So that's why we call it amphetamine-like. So your Ritalin is one of these, okay? We use these to increase a child's attention span and cognitive performance, decrease the impulsiveness, hyperactivity, and restlessness. And there's a good story that I actually usually tell during mental health, but I may just tell you now. I have a child that is on a medication for ADHD, and that was a really big thing for us that we had to do that. But cool story where she kind of showed me what it really looks like. We went to Pharm and we were taking a walk through the park, and as we were coming up one of the trails, there was a big mud puddle, and I just know this child, and she doesn't take her medication on the weekends. So I said to her, Lily, do not even think about jumping in that mud puddle. And as she's walking forward, she looks up at me and she says, you know what's funny? That you tell me not to jump in that mud puddle, and my brain tells me that I should jump in that mud puddle, and it's a hard choice. And it really gave me a look into what's going on for her for the impulsiveness that in her mind it's saying that's what she wants to go do, so she should go do it. That's the impulsiveness, and I'm telling her not to. And for her, it's a hard choice, and that's true. It is a hard choice. So it also helps us when we're caring for and dealing with children that have ADHD to kind of get an insight of what's going on inside their brains, so we can be more patient. So methylphenidate, that comes in, is also still Ritalin, but comes in other medications as well, but typically that's when we see. And then you'll see also another amphetamine-like medication is Provigil. In Provigil, the action is not fully understood, but actually we use this quite a bit for narcolepsy, and believe it or not, third shift nurses are actually approved to use Provigil for work shift disorder. So you may know or will be yourself maybe someday on something like that. They also are now using it for MS-related fatigue. So these are off-label uses that Provigil is approved for because it's going to increase that wakefulness and concentration to be up. So here's your action for your Ritalin, your uses, your interactions are all listed here for you. You can go through this in the PowerPoint itself. These will all be posted for you, the updated ones, as I post these videos as well. But this one, I listed this out for you. That does not mean you have to do a separate one, but this is going to be the main one that you guys are going to be seeing in patients, especially if you end up working in any kind of pediatric setting. But pediatrics aren't the only ones that take that. We still have adults that are on ADHD medications as well, so you can read through the rest of this. Again, it's basically doing the same exact thing as an amphetamine. And then make sure you, and anytime I list this slide for you with the nursing process, I want you to look at your nursing processes for these classification of medications. Make sure that you're digging into those parts in the books, because that's what we're going to be as nurses. So you need to make sure that you know, what is my assessment? What would a nursing diagnosis look like? What's my planning for this patient? What kind of interventions, which is going to include my teaching, and how do I evaluate it? So there's some nursing interventions for you, again, for your drug card to list on there. And if you'll see down here at the bottom about counseling, so it's going to depend on the child and the age of the child, but many times we do recommend therapy for patients with ADHD. So make sure that you keep all of this stuff together and put it on your drug card. And then we have your anorexins, okay? So these are going to be medications that are going to reduce appetite. So there's a nice list here for you. Again, just do one card as an anorexic, and then you can list these on the back side. I know we did talk in class about Adipex, which we'll not see on here, but you may, eventually we may get around to something like that, but here's the ones that your book wanted us to focus on. So its action, it's going to reduce its uses to reduce the appetite. So you have some side effects there. Once again, it's going to include much of the same things that our amphetamines included. So then you have analeptic. Theophylline is one of the ones that we use quite often, and this is so we can stimulate respirations in newborns. I listed it in there for you, though you will work with this more in your peds and OB section. So if you want to go ahead and make your drug card now, but this, I will tell you, will not be on your test. Then you have respiratory CNS stimulants. This we can use for respiratory depression that's been caused by overdose. So something like, we also use a Narcan to reverse that, but this is going to be more of a stimulant, a CNS stimulant, not a blocker. So our Narcan's a blocker. This is an actual stimulant. So we can also use this for patients that have received too much anesthesia. Also can be used in COPD patients. So for this one, your drug card is going to be a respiratory CNS stimulant, and this would be your medication that you're going to use on that. Side effects, once again, are going to be very similar to that. So we've got this chapter, and then I'm going to move straight into 21. This is a lot longer, so I probably won't get through this whole thing. I'll have to probably move it into the next one as well, but I'm going to get started anyway. So you have your central nervous system depressants. Again, we did do some talking about this. I know somebody talked in class about sleep, REM versus non-REM, so REM versus non-REM. And so what you're going to need to know the differences between this is that REM is where that really deep sleep happens. That's where dreams happen. That's where sleep paralysis happens. And we typically go through 4 cycles of that per night. I mean, obviously, depending on the patient. You know what? What's under here? Okay, so the patient's going to feel best after completing all stages of this. We will go into this more again come next term. I do a whole thing on sleep for that, but it's important for us to get started here. So non-pharmacological interventions that can be done, again, somebody read this during class, so avoiding alcohol and caffeine. So I know we talked a little bit about how alcohol is something that some people think they actually need it for sleep, but what actually happens is it helps a person basically to pass out, but it won't help stay asleep, and you don't get good rest on that, and you definitely don't wake up feeling good usually afterwards. But make sure you put all of these in somewhere, or be aware of the non-pharmacological interventions. It's always important that we have those things. So for insomnia, again, more common in female patients, and we can use sedative hypnotics as the treatment. Again, non-pharmacological management, same stuff's kind of listed there again. So sedative hypnotics, they produce the mildest form of central nervous system depression, because we want to be very careful when we're depressing the CNS. Again, knowing what the CNS does is very important, because if I don't, then I won't know what happens if I depress it, okay? So barbiturates is one of the big ones that we can use for CNS depression. But it's very important for the nurse to monitor vital signs, especially respiratory, as well as psychiatric, because it is affecting the CNS and depressing it. So I have this potential that my patient's going to have depression, suicidal ideation. There's some side effects for you in teaching for do not use alcohol. Why? Because both would be a CNS depressant. And do not alter the sleep patterns. We learned that right from in class. Benzodiazepines are going to be something that we're going to keep coming around, because we use it for so many different things in nursing and in the medical field. So benzodiazepines are going to be a good drug card for you to have, and you may end up having more than one just because we use them for multiple different things, and you may not be able to get all the information on there. So there's some stuff here from class for you that's all listed on here. So we know benzodiazepines can be used to reduce anxiety. We know that it can be used to help with sleep. We know it can be used to help calm someone prior to surgery or for things that are happening in the hospital. But it also can cause respiratory depression. So I have to be very careful with that. When I used to work in the ICU, there would be times we would have patients on an Ativan drip. So that's benzodiazepine in its pure form going right into the vein, and they would be having that come in constantly for alcohol withdrawal. So we have to make sure we watch their respirations. Remember, this is the one, and you're definitely going to need to know this, that the antidote is romazicam for that. I think it's actually C-O-N. I'm going to have to look that up. But either way, you guys make sure that you look that up and see that you know what the antidote is. So it's much like for an opiate, if I have an overdose of an opiate, I'm going to use Narcan. If I have an overdose of benzodiazepine, I'm going to use romazicam. So it can cause relaxation, and it is addictive, or it can be addictive. Do not drink alcohol, and yet understand why. Okay, again, 2 CNS depressants. I don't want that. Teach patient to increase fluid and fiber, and then make sure you're reading pages 296 and 297. So sedative hypnotics, general side effects are listed here for you that can happen. Again, look at drug tolerance and drug dependence. You want to make sure that you're assessing that in your patient. You know, make sure that we're not seeing maybe tolerance versus tachyphylaxis, right? We want to make sure that we know the difference for those, because those are always fair game types of questions, because we as nurses need to know that. The respiratory depression, I think I've said it like 6 times now, so you're going to see something on that. With the barbiturates, we did talk about this a bit, and that there is this, long-acting, intermediate-acting, short-acting, ultra-short-acting, but know that all barbiturates need to be restricted to 2 weeks or less in time, especially because of the drug tolerance, but also because of the side effects. So you can do 1 card for barbiturates, and then on the back, if you want to put like the long and the short and the intermediate, that's totally fine. But you don't need, I'm not going to ask you specifically on each one of those with that. Here's your list of benzodiazepines that are used as hypnotics. So for anxiety, many times we'll use Ativan and Valium in the hospital, for a quick acting, like in the IV or an IM. But I'm sure a lot of you have heard either people or seen people that have been prescribed Xanax. That's something that in Brighton, I'm withdrawing people from that all the time. So there's your action. It's going to interact with GABA to reduce neuron excitability. So remember, benzodiazepines can actually help during a seizure as well because it's reducing that neuronal excitability, which, remember, the seizure is there's something going haywire in the neurons within the brain. Used for anxiety, used for insomnia. Again, it can be used for seizures. I mean, we're going to keep adding to these. And I've got 6 seconds left, so I'm going to stop at this slide and pick up with the next one.